Hello everybody, I am Dr. Sunanda Chava. Today I would like to talk about water brush. So what is water brush? Water brush is a mixture of saliva and stomach acid that can cause an unpleasant sour taste in the mouth. In chronic esophageal reflux disease, that is GERD, the water brush can occur. In GERD, stomach acid regurgitates into esophagus and mouth and causes salivary glands to produce excessive saliva, that is spit. So it can increase up to 10 ml per minute. This causes feeling of liquid stuck in the back of the throat and might taste sour or acidic. This water brush is also called acid brush or pyrosis idiopathica. Barrett's esophagus can occur in the esophagus when acid regurgitates from stomach into esophagus. The esophageal pipe becomes narrowed and it is potentially a precancerous condition. It causes severe non-cardiac chest pain or severe dysphagia. The patient might find it very difficult, very painful to swallow when they eat, and this can be due to Barrett's esophagus. The esophagus gets narrowed because of the acid intake, acid regurgitation. So, in Barrett's esophagus, there is change of one adult type of epithelium into another one that's called metaplasia. This can occur and this becomes potentially precancerous condition. So it can be seen in routine orthopantomographs or barium radiography. The Barrett's esophagus is a narrow tube. Hiatus hernia. So coming to hiatus hernia, what is it? It's a condition where part of the stomach bulges up to the diaphragm into the chest and can cause heartburn and GERD, or might radiate to back also, or it might remain asymptomatic. Hiatus hernia can cause dysphagia, shortness of breath, persistent cough because of irritation of acid in the mouth caused by acid in the throat. It can cause cough, asthma-like symptoms, that's wheezing, burping, and throat and mouth issues like sore throat, hoarseness, lump filling in the throat, nausea, vomiting, and paraesophageal hernia and bowel obstruction. So, hiatus hernia can cause all these signs and symptoms. In water brush, the acid causes chemical erosion of the palatal surfaces or inner side of the upper front teeth inner aspect. So, which the teeth will become eroded in that aspect because of acid intake. So, there will be erosion of the teeth and it can cause sensitivity or pain. And usually it goes unnoticed. Inner side of the lower front teeth are protected. Upper are attacked. Lower are protected because of presence of the tongue in the resting position. The incisive papilla, the papilla behind the upper incisors, that will get eroded or attacked by acid and it might become red. The palatal surface, the palate also can become red and it can cause pain or burning sensation in the mouth. The patient will point the area with the finger and show you. And if you get the doubt of red incisive papilla and eroded palatal surface, ask about the history of excessive salivation or acid regurgitation in the mouth, burning sensation in the stomach, or gastritis. When they give positive history, you can make out that it is water brush. You can ask excessive salivation, siluria. So that can lead to the diagnosis and you can later deal with the dental symptoms, signs and symptoms, and then can refer to gastroenterologist for further management. The patient will complain of pain or burning sensation in the palate, irritation in the throat, and history of GERD if diagnosed, or acid coming into the mouth can give a clue. As I told you, and lead to diagnosis. There will be hypersalivation. The acid in the throat can stimulate the salivary glands to produce saliva to neutralize the effect of acid on the tissues. So there will be hypersalivation. That is called esophageal reflex. Esophageal salivary reflex. There might be loss of appetite or the hunger might come down. How do you manage a case of water brush? So you have to do lifestyle changes. The other one is medical management and surgical management. Lifestyle adjustments, the person has to, the proper history has to be taken first, and you have to see if the patient is smoker or he is obese or his eating habits are not good, eating spicy food and all. Like sleep with the head raised with the help of a pillow, or sleep on the left side to avoid the attack of acid into the throat. The acid coming from the stomach into the throat, or standing position also better. Obesity, the person has to lower the weight, and then the tight clothing along the abdomen can be and chest can be avoided. They can use loose pants. Then they should not take alcoholic drinks, carbonated drinks. They have to avoid hot spicy food, avoid fries, citrus fruits, onions, garlic, and fatty meals. And then the person has to take low frequent meals instead of taking 3 bulky meals. Then the person has to eat slowly so that the food is digested slowly and then ingested. Light dinner, particularly 3 hours before the bedtime in the night time, they can take. Allow some time to digest and then you sleep after eating. Avoid coffee or tea. Medications, antacids like Digen can help. And then H2 blockers, that is histamine receptor antagonists, like cimetidine, famotidine can be used. Proton pump inhibitors like omeprazole, lansoprazole can be used. And most important thing is peptic ulcers can be present in the stomach or the intestines, that is small intestine, large intestine and all. So this can cause burning or pain in the abdomen. So ladies usually complain of pain in the right abdomen. If you put a finger and ask the patient to inhale, the patient, you can make out the pain in the area. So that usually not used by clinicians, but some people use it. So this will lead to endoscopy, and there will be ulcers in the stomach or intestines. The ulcers in the stomach are called gastric ulcers. The ulcers in the duodenum is called duodenal ulcer. So usually if a pain happens before eating food because of acid production in the stomach due to hunger during a meal time, then pain if before food, if it occurs, it's usually stomach ulcers. Pain after eating, pain sometime after eating food occurs in the abdomen, stomach, then usually it's a duodenal ulcer, intestinal ulcer. Then they can go for endoscopy, duodenoscopy, jejunoscopy, different radiographic techniques to examine the throat and then esophagus, stomach, and then intestines and all. So surgery will be last resort, as in case of hiatus hernia or GERD, hiatus hernia and all. And water brash is very important because this terminology is not very common. This term is not commonly very much used. This can lead to so many symptoms. So just pain in the mouth, in the incisive papilla region, or erosion in the upper palatal surface of upper incisors can lead to diagnosis of GERD, hiatus hernia and all. So it can also lead, in this condition there might be associated Barrett's esophagus, which is potentially malignant, and this can also lead diagnosis of ulcers in the stomach and intestines. So it's very important. Barium endoscopy and all are very important. A dentist might be able to detect a case and refer to gastroenterologist and prevent so many complications. Okay. Thank you. See you in the next video. Bye.